Most women with PCOS are told their testosterone is high and they're handed birth control, metformin, or spironolactone, sometimes all three. And while those things, yes, they can manage symptoms, none of them are actually fixing why your androgens are elevated in the first place. So today I'm going to break down the real root cause of high testosterone in PCOS, what actually works to bring it down, and how to rank your options so you're not just guessing. So, little disclaimer here, yes, I am a physician assistant, but this video is for educational purposes only and is not medical advice. Please always consult with your healthcare professional before making changes to your health, supplements, or medications. Okay, so before we get into the solutions, I want you to understand what's actually happening here in PCOS. Because if you don't understand the root, none of these solutions are going to make sense. So PCOS is a metabolic and a hormonal condition. In the majority of cases, elevated androgens, meaning elevated testosterone and DHEA, are being driven by one primary mechanism, and that is called insulin resistance. So here's how it works. When your cells stop responding to insulin properly, your pancreas compensates by pumping out more of it. That chronically elevated insulin directly stimulates your ovaries to produce more testosterone. At the same time, high insulin suppresses a protein called SHBG, sex hormone binding globulin. And it basically does exactly what the name says. It's a protein that binds to testosterone in your blood and keeps it inactive. So when SHBG drops, more of your testosterone is going to become free and active. So you get a double hit here. You have more testosterone being produced and more of it circulating in your bloodstream. So that is what's driving your acne, your hair loss, irregular cycles, and excess hair growth. This is why addressing insulin resistance is the single most important thing you can do for elevated androgens in PCOS. Everything else we talk about today works better when you address this first. So I want to briefly chat about blood work, because I want you to know what to ask for when you go to your doctor. You want to look at free and total testosterone, DHEA, SHBG, fasting insulin, and fasting glucose. Most standard panels are going to run your total testosterone, and that's about it. If you don't run your free testosterone, you can completely miss the high testosterone sign on labs. And if you've had all these labs done, you still feel like you don't have the answers, that could be why. We run comprehensive panels in our coaching program, and this is usually what we're assessing for PCOS. Okay, so here are the lifestyle modifications. I'm going to rank them from most important to least important in order to improve your high testosterone in PCOS. Number one is weight loss in overweight individuals. If this applies to you, this is the highest leverage thing you can do on this entire list. Even just a 5 to 10% reduction in body weight has been shown to significantly reduce androgen levels, improve insulin sensitivity, restore ovulation, and improve SHBG. Fat tissue, particularly visceral fat, is metabolically active and contributes directly to insulin resistance and androgen production. So losing weight in PCOS is hard because of the insulin resistance itself. I'm not at all dismissing that. I know it is harder, but it's still the most important thing that you should do. The longer that you stay overweight, the harder it is to lose it in the future, and the cycle of insulin resistance, high testosterone, and weight loss resistance just gets worse and worse. Number two, improving insulin sensitivity through diet. So this means you're going to need to reduce refined carbs, processed foods, added sugars. Not eliminating carbs entirely. I'm not saying carbs are the devil, but stabilizing blood sugar throughout your day is absolutely crucial. So you want to be having protein at every meal. You need to have fiber in order to slow glucose absorption. And you want to avoid those blood sugar spikes that trigger insulin surges. So a higher protein diet especially is very, very important here. So protein has a lower insulin response than carbohydrates. It's going to preserve your muscle mass, which improves metabolic rate, and it keeps you full. So that's going to support body composition without you having to restrict to extreme degrees. This is one of the most important daily things that you need to implement. Number 3 is resistance training. So muscle tissue is the primary site of glucose disposal in your body. This means that the more muscle you have, the more efficiently your body uses your blood sugar and your insulin. And also, an added bonus of having those high testosterone levels is you can actually build muscle easier. So use it. Regular resistance training, 3 to 5 sessions per week, improves insulin sensitivity, it supports healthy body composition, and over time, it's going to directly impact those high testosterone levels. This is not optional if you have PCOS. It is one of the most evidence-backed interventions that we have, and honestly, nowadays, it's not expensive to do it. You can get a $10 membership, gym membership. Number 4 is moderate aerobic exercise. So on top of the resistance training, moderate steady state cardio, so walking, cycling, incline treadmill, elliptical, they are going to further help your insulin sensitivity and glucose regulation. But the emphasis I want to put here is moderate. You do not need to be doing excessive high intensity cardio. So yes, what I'm saying is you don't need to take up running if you have PCOS, especially if you hate it. So when you do that high intensity cardio, it actually can spike your cortisol even more, which can further worsen your insulin resistance and make PCOS symptoms worse. So the simplest thing here is just make sure you're walking daily. All right. Next topic, we're going to move into supplements, and I'm also going to rank these from most important, in my opinion, to least important. Number 1 is inositol. So specifically, myo-inositol and D-chiro-inositol. This is the most researched, most evidence-backed supplement for PCOS and elevated androgens. Inositol is involved in insulin signaling at the cellular level. So it basically tells your cells to respond to insulin more effectively. So studies show it reduces your testosterone, it can improve ovulation, it lowers your fasting insulin, and it improves egg quality in women trying to conceive. The most studied ratio for this is 40:1 myo-inositol to D-chiro-inositol. This is my top supplement recommendation for any woman with PCOS. It is addressing a root mechanism, not just a symptom. Number 2, berberine. I love this supplement, not just for PCOS, but especially in this case. So berberine is a plant compound, and it activates an enzyme called AMPK. This essentially improves insulin sensitivity at the cellular level. It has been directly compared to metformin in studies, and it shows similar glucose lowering effects. It's also anti-inflammatory and really great for your gut. So women who want a natural alternative to metformin or who want to layer in additional insulin, tools, this is highly effective. You want to start low and titrate up, as you can have GI side effects with it initially, and you want to always be taking this with food. Number 3 is NAC or N-acetylcysteine. N-acetylcysteine or NAC is a precursor to glutathione, and that is your body's most powerful antioxidant. So it has a lot of actual meaningful research in PCOS. It improves insulin sensitivity. It has been shown to reduce testosterone and LH levels. It helps liver detox. It also has antioxidant effects that's going to reduce the oxidative stress that is chronically elevated in PCOS. It's also been studied alongside inositol with really good results. So you could pair these two together for a really powerful outcome. Number 4 is omega-3 fatty acids. PCOS is an inflammatory condition. Omega-3s, especially if they have EPA and DHA from fish oil, it reduces inflammation, improves insulin sensitivity, supports liver function, and has actually been shown to lower testosterone and raise SHBG in women with PCOS here. Quick note though, the quality of this supplement does matter. You want to make sure you have a high EPA DHA product, not just a cheap fish oil capsule. Anti-inflammatory support is absolutely crucial in PCOS, and omega-3s is one of the best ways to go about that. Number 5 is vitamin D. Vitamin D deficiency is very common in general, but especially in PCOS patients. And the deficiency is directly associated with worsening insulin resistance and higher testosterone levels. If you are deficient, supplementing has been shown to improve the testosterone levels, insulin sensitivity, and also menstrual cycle regularity. So this one, it actually, it matters in general, but it mostly matters if you're deficient in vitamin D. So that's why testing is really important here. Number 6, and one of my favorites, is spearmint tea. This one has genuine research behind it, and it's worth including. Spearmint has anti-androgenic properties, meaning it can directly reduce free testosterone levels. Studies have shown that 2 cups of spearmint tea daily reduced free testosterone in women with a PCOS over a 30-day period. So it's not going to do, all the heavy lifting on its own, but this layered on top of some of the other things we've talked about can be really, really helpful and low cost. I have used, spearmint tea in my PCOS clients very commonly. I often have them make just a spearmint tea, like iced tea, and keep it in the fridge, and they drink it throughout the day. Number 7 is saw palmetto. So saw palmetto, this one's going to be a little different. It works by inhibiting 5-alpha reductase. So this is the enzyme that converts testosterone into a more potent form called DHT. DHT is actually the hormone that triggers hair loss and excessive hair growth. So if those 2 things are your primary symptoms, this supplement might be good for you. It's a more symptom-targeted intervention rather than a root cause supplement. So just be aware, it does have really good, reasonable evidence, and I've seen it work very well, but I still would recommend working on those root cause issues if you're also adding this in. Number 8, reishi mushroom. Reishi has 5-alpha reductase inhibiting properties very similar to the last one, saw palmetto, along with significant adaptogenic and anti-inflammatory effects. It's going to support immune regulation and stress response, which is relevant because cortisol dysregulation worsens insulin resistance and testosterone production. So the evidence here is a little bit less robust than some of those top supplements I already recommended, but the mechanism here is very sound, and I have seen it work very well in other, other supplement stacks with PCOS clients. Number 9 is licorice root. Licorice root has been shown to reduce testosterone levels in women. It seems to work by reducing an enzyme involved in androgen production in the ovaries. The research is interesting, but it doesn't really have a big evidence base for the research. So an important caveat with this to note as well is that licorice root can raise your blood pressure. So if you're someone with hypertension, I wouldn't necessarily recommend adding this one in the mix. Okay, so next we are moving to the medications. And again, I'm going to kind of break these down and rank them in order of what may be most helpful. One is metformin. So metformin works by reducing glucose production in the liver. It also improves cellular insulin at the cellular level. So in that sense, it is addressing a real underlying mechanism with PCOS. But there are a few critiques with metformin. So it's often given to women with PCOS without addressing any of the underlying issues. So that I don't agree with. We need to be working on diet, lifestyle, root causes of metabolic dysfunction, not just handing out the metformin like a Band-Aid approach. Also, another critique of it is it can deplete your B12 levels. So you need to be very aware of that if you're on metformin long term. You also can have GI side effects with metformin, so be aware of that. If you're on metformin, that is totally fine, but again, this should just be one piece of the puzzle. You need to be addressing other things with it. It's not going to cure your PCOS in itself. Okay, next one, GLP-1 agonists. You've heard them before: Ozempic, semaglutide, Wegovy, Mounjaro, tirzepatide, now retatrutide. So these are huge right now, and they are being prescribed for PCOS even more so recently. So how do they work? They reduce or they slow the gastric emptying, they reduce your appetite, and they are going to improve insulin signaling. And yes, the weight loss that you have from it can produce a lot of helpful benefits when it comes to improving the testosterone levels and the insulin resistance. I have definitely seen a huge success in PCOS clients that are on GLP-1s. Now, I'm never going to recommend you starting this without addressing underlying issues and habits, because here's the issue with that. GLP-1s, you will lose weight. Unfortunately, with them, you can also lose muscle. So if you are losing muscle while you're on this and you're not resistance training, your metabolism is going to go down, and that is going to create an even worse situation. Okay, so I will say that some new and upcoming forms are amazing because muscle loss may not be quite as much of a factor. And also, in addition, it can help with your inflammation. So the biggest issue here is we want to make sure that you're not regaining the weight back after you stop the medication, okay? You can also have GI side effects with these medications. So I would recommend starting low dose, slowly working your way up, and most definitely working with a practitioner if you're going to start on something like this. Okay, third one, spironolactone. Okay, this is probably one of the most commonly prescribed for PCOS, and I have a few of my own, opinions about this. So spironolactone, how does it work? It blocks androgen receptors. So your body can't respond to testosterone even if it is present. It's commonly prescribed for the symptoms of high testosterone and PCOS, so things like acne, hair loss, excessive hair growth. It can be helpful in reducing those symptoms. I will not negate that. But here is the critical point. Spironolactone does not lower your testosterone. It does not address insulin resistance. It's not addressing why your ovaries are overproducing testosterone in the first place. It is basically blocking the receptor so that the downstream effects are reduced. So the root cause of it is not touched whatsoever. Women are often on spironolactone for years with no improvement in the underlying condition. So that means when they get off of it, every symptom returns. It also could mean they're on this so they have less symptoms, but they don't realize that they're infertile, they're not ovulating. So yes, it can have a place in acute symptom management, but it should never be the, sole treatment that you use in PCOS. Okay, so if you have PCOS and you feel like you've been trying to manage all the symptoms without anyone actually getting to the root cause of it, this is the most common thing that I hear. It's exactly what we dig into with our coaching programs, comprehensive lab testing, and a real protocol that's built around your specific pattern of PCOS, because yes, there are multiple different types. And we use a strategy that actually is going to move the needle with the root cause. So the link to book a free consult will be down below in the description. If this episode was helpful, save it, share it with a friend. Thank you so much, guys. I'll see you in the next one.